Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 15 practice NCLEX questions. Without delay, let's get started.
A client has developed a hospital-acquired pneumonia. When preparing to administer cephalexin 500 milligrams, the nurse notices that the pharmacy sent cefazolin. What should the nurse do? Select all that apply. 1. Administer the cefazolin. 2. Verify the medication prescription as written by the physician. 3. Contact the pharmacy and speak to a pharmacist. 4. Request that cephalexin be sent promptly. 5. Return the cefazolin to the pharmacy. The correct answers are 2, 3, 4, and 5. One of the rights of drug administration is right medication. Cefazolin was not the medication prescribed. The pharmacist is a professional resource and serves as a check to ensure that clients receive the right medication. Returning unwanted medications to the pharmacy will decrease the opportunity for a medication error by the nurse who follows the current nurse. A client has the following arterial blood gas values: pH 7.52, PaO 250, PaCO 228, HCO 324. The nurse determines that which of the following is a possible cause for these findings. 1. Chronic obstructive pulmonary disease. 2. Diabetic ketoacidosis with Kussmaul's respirations. 3. Myocardial infarction. 4. Pulmonary embolus. The correct answer is 4. PaCO2 of 28 and PaO2 of 50 are both abnormal. The PaO2 of 50 signifies acute respiratory failure. In evaluating possible causes for this disorder, the nurse should consider conditions that lead to hypoxia and hyperventilation, such as pulmonary embolus. COPD is typically associated with respiratory acidosis and elevated PaCO2. The client with diabetic ketoacidosis most often has metabolic acidosis. A myocardial infarction does not often cause an acid-base imbalance because the primary problem is cardiac in origin. The nurse reviews a client's electrolyte results and notes that the potassium level is 5.4 milliequivalent per liter. Which should the nurse observe for on the cardiac monitor as a result of this laboratory value? 1. ST elevation. 2. Peak P waves. 3. Prominent U waves. 4. Narrow peak T waves. The correct answer is 4. A serum potassium level of 5.4 milliequivalent per liter is indicative of hyperkalemia. Cardiac changes include a wide, flat P wave, a prolonged PR interval, a widened QRS complex, and narrow peak T waves. A nurse is teaching the families of clients with chronic mental illnesses about causes of relapse and rehospitalization. What should the nurse include as the primary cause? 1. Loss of family support. 2. Non-compliance with medications. 3. Sudden changes in medications. 4. Non-attendance at treatment programs. The correct answer is 2. Non-compliance with medications is documented as the primary cause of relapse. Although loss of family support, sudden changes in medications, and non-attendance at treatment programs may contribute to relapse, these factors are not as significant as medication non-compliance as causes of relapse. The most common reason given by mentally ill clients for non-compliance with medications is their uncomfortable adverse effects. When teaching the families, what needs should the nurse identify as the greatest? 1. Alternative ways to manage the adverse effects. 2. Home visits to set up a week's supply of medications. 3. Family monitoring of the administration of medication. 4. Outpatient monitoring of medication compliance. The correct answer is 1. Ways to decrease or manage adverse effects without additional medications is crucial. Although home visits, family monitoring, and outpatient monitoring may help, if the adverse effects are not controlled, the client is less likely to take the drug, which would interfere with its effectiveness. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at AlphaNursGuide.com. Back to the questions. Which of the following statements about a fetal biophysical profile would be incorporated into the teaching plan for a prima gravida client with insulin-dependent diabetes? 1. It determines fetal lung maturity. 2. It is non-invasive using real-time ultrasound. 3. It will correlate with the newborn's APGAR score. 4. It requires the client to have an empty bladder. The correct answer is 2. The fetal biophysical profile, a non-invasive test using real-time ultrasound, assesses 5 parameters: fetal heart rate reactivity, fetal breathing movements, gross fetal body movements, fetal tone, and amniotic fluid volume. Fetal heart rate reactivity is determined by a non-stress test. The other 4 parameters are determined by ultrasound scanning. The results are available as soon as the test is completed and interpreted. The lecithin-sphingomyelin ratio is used to determine fetal lung maturity. Although the fetal biophysical profile is useful in predicting which fetuses may be at greater risk for compromise, there is no correlation with the newborn's APGAR score. The biophysical score is sometimes referred to as the fetal APGAR score. A score of 8 to 10 indicates fetal well-being. Use of an ultrasound requires the mother to have a full bladder. The client with an Axis 1 diagnosis of schizophrenia, undifferentiated type, is acutely psychotic and exhibits religious delusions and hallucinations, loose associations, and concrete thinking. When the nurse offers a client her medication, the client states, "I don't need that. God will heal me." The nurse should respond to the client by saying, 1. God helps those who help themselves. 2. God wants you to take your medicine. 3. God is important in your life, but the medicine will help you too. 4. This medicine will help clear your thoughts and decrease anxiety. The correct answer is 3. Stating that God is important in the client's life recognizes the client's cognitive and perceptual disturbances and level of anxiety, and acknowledges the client's message in a respectful and neutral manner, while adding that the medicine also will help, clearly and directly states the need for medication. Stating, God helps those who help themselves challenges the client. Stating, God wants you to take your medicine is deceitful. Stating, medicine will help clear your thinking and decrease anxiety, would be helpful to the client later when she is less acutely psychotic and anxious. A prima gravida client admitted to the labor area in early labor tells the nurse that her brother was born with cystic fibrosis, and she wonders if her baby will also have the disease. The nurse can tell the client that cystic fibrosis is 1. X-linked recessive, and the disease will only occur if the baby is a boy. 2. X-linked dominant, and there is no likelihood of the baby having cystic fibrosis. 3. Autosomal recessive, and that unless the baby's father has the gene, the baby will not have the disease. 4. Autosomal dominant, and there is a 50% chance of the baby having the disease. The correct answer is 3. Cystic fibrosis and other inborn errors of metabolism are inherited as autosomal recessive traits. Such diseases do not occur unless there are 2 genes for the disease present. If one of the parents does not have the gene, the child will not have the disease. X-linked recessive genes can result in hemophilia A or color blindness. X-linked recessive genes are present only on the X chromosome and are typically manifested in the male child. X-linked dominant genes, which are located on and transmitted only by the female sex chromosome, can result in hypophosphatemia, an inborn error of metabolism marked by abnormally low serum alkaline phosphatase activity and excretion of phosphorethynolamine in the urine. This disorder is manifested as rickets in infants and children. Autosomal dominant gene disorders can result in muscular dystrophy, Marfan syndrome, and osteogenesis imperfecta. Typically, a dominant gene for the disease trait is present along with a corresponding healthy recessive gene. What is the most appropriate method to use when drawing blood from a child with hemophilia? 1. Use finger punctures for lab draws. 2. Prepare to administer platelets. 3. Apply heat to the extremity before venipunctures. 4. Schedule all labs to be drawn at one time. The correct answer is 4. Coordinating labs to minimize sticks reduces trauma and the risk of bleeding. Finger sticks in general are more painful and associated with more bleeding than venipunctures. In hemophilia, platelets are typically normal, Heat would increase vasodilation and increase bleeding. A 38-year-old client at about 14 weeks gestation is admitted to the hospital with a diagnosis of complete hydatidiform mole. Soon after admission, the nurse would assess the client for signs and symptoms of which of the following? 1. Pregnancy-induced hypertension. 2. Gestational diabetes. 3. Hypothyroidism. 4. Polycythemia. The correct answer is 1. Hydatidiform mole is suspected when the following are present: pregnancy-induced hypertension before the 24th week of gestation, brownish or prune-colored vaginal bleeding, anemia, absence of fetal heart tones, passage of hydropic vessels, uterine enlargement greater than expected for gestational age, and increased human chorionic gonadotropin levels. Gestational diabetes is related to an increased risk of preeclampsia and urinary tract infections, but it is not associated with hydatidiform mole. Hypothyroidism, not hypothyroidism, occurs occasionally with hydatidiform mole. If it does occur, it can be a serious complication, possibly life-threatening to the mother and fetus from cardiac problems. Polycythemia is not associated with hydatidiform mole. Rather, anemia from blood loss is associated with molar pregnancies. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. After teaching the mother of an infant with pyloric stenosis about the disease, which of the following is stated by the mother as a cause, indicates effective teaching? 1. An enlarged muscle below the stomach sphincter. 2. A telescoping of the large bowel into the smaller bowel. 3. The result of giving the baby more formula than is necessary. 4. The result of my baby taking the formula too quickly. The correct answer is 1. Pyloric stenosis involves hypertrophy of the pylorus muscle distal to the stomach and obstruction of the gastric outlet, resulting in vomiting, metabolic acidosis, and dehydration. Telescoping of the bowel is called intussusception. Overfeeding, feeding too quickly, or underfeeding is not associated with pyloric stenosis. After surgery to repair a tracheoesophageal fistula, an infant receives gastrostomy tube feedings. After feeding the infant by this method, the nurse cradles and rocks the infant for about 15 minutes, primarily to help accomplish which of the following? 1. Promote intestinal peristalsis. 2. Prevent regurgitation of formula. 3. Relieve pressure on the surgical site. 4. Associate eating with a pleasurable experience. The correct answer is 4. The nurse can help meet the psychological needs of an infant being fed through a gastrostomy tube by rocking the infant after feeding. The infant soon learns to associate eating with a pleasurable experience and learns to trust the caregiver. Rocking the infant will not promote peristalsis or prevent regurgitation. Holding the baby will not relieve pressure on the surgical site. However, holding the child right after feeding promotes comfort and pleasure. While making rounds, the nurse finds a client with COPD sitting in a wheelchair, slumped over a lunch tray. After determining the client is unresponsive and calling for help, the nurse's first action should be to 1. Push the emergency response button. 2. Call the rapid response team. 3. Open the client's airway. 4. Call for a defibrillator. The correct answer is 3. The nurse has already called for help and established unresponsiveness, so the first action is to open the client's airway. Opening the airway may result in spontaneous breathing and will help the nurse determine whether or not further intervention is required. Pushing the code blue button may not be the appropriate action if the client is breathing and becomes responsive once the airway is open. A quick assessment upon opening the client's airway will help the nurse to determine if the rapid response team is needed. Calling for a defibrillator may not be necessary nor the appropriate action once the client's airway has been opened. Which of the following complications is associated with mechanical ventilation? 1. Gastrointestinal hemorrhage. 2. Immunosuppression. 3. Increased cardiac output. 4. Pulmonary emboli. The correct answer is 1. Gastrointestinal hemorrhage occurs in about 25% of clients receiving prolonged mechanical ventilation because of the development of stress ulcers. Clients who are receiving steroid therapy and those with a previous history of ulcers are most likely to be at risk. Other possible complications include incorrect ventilation, oxygen toxicity, fluid imbalance, decreased cardiac output, pneumothorax infection, and atelectasis. The nurse interprets which of the following as an early sign of acute respiratory distress syndrome in a client at risk? 1. Elevated carbon dioxide level. 2. Hypoxia not responsive to oxygen therapy. 3. Metabolic acidosis. 4. Severe unexplained electrolyte imbalance. The correct answer is 2. A hallmark of early ARDS is refractory hypoxemia. The client's PaO2 level continues to fall despite higher concentrations of administered oxygen. Elevated carbon dioxide and metabolic acidosis occur late in the disorder. Severe electrolyte imbalances are not indicators of ARDS. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.